back. We hear all kinds of advice about caring for our teeth, although information is easier to get than ever before. Some old myths still persist. Dr. Brian Dunlap of Dunlap Dental joins us now to help us separate facts from fiction when it comes to oral health. Thanks for joining us today.
I appreciate you guys having me.
Let's talk about the first one, oil pulling. We hear about this all the time. What do you think?
Yeah, it seems to be the latest rage. I mean, you know, you're on the internet, just, you know, on Yahoo or somewhere, and you have these oil pulling ads up. You know, I looked into it, and it seems to be that it wants you to swish coconut oil in your mouth for quite a long time, which I don't know how comfortable that would be, but I have found no proof that it helps your gums or your teeth or whiten your teeth or anything like that. So I'm afraid, folks, as far as that's concerned, maybe there's some other health benefits, but as far as your dentist is concerned, I haven't found any that seem to be helping.
That's too bad. It seemed like one of those too good to be true whenever you read about it, all that it can do. Applying aspirin.
Well, you know, I hear this all the time. I mean, I've been a dentist for 17 years now, and I'll have people come in and say they had a toothache and they put an aspirin on it. And, you know, by that mentality, if you had a headache, you'd put the aspirin on top of your head and expect it to work. It doesn't work like that. So, you know, putting an aspirin on your tooth or on your gums can actually burn your gums, believe it or not, and you're not going to get a whole lot of relief. If you need some relief, actually take the aspirin like you normally would. And obviously consult your dentist. If you have a toothache, you need to get in because it's likely you have an infection.
Let's talk about the next myth, which is one that I asked you maybe on your first day here on the show. I said, Dr. Dunlap, I feel like I'm over-whitening my teeth with these white strips, falling asleep with them on. Does that cause damage over whitening over time? Well,
and Mallory's teeth certainly are white, so, you know, it's working. But, you know, what I'd say about that is like everything we always talk about, guys, and it's pretty much true in almost all of life, moderation. You know, just do it you don't want to be whitening your teeth every single day. That's not healthy. But just, especially if you're consulting your dentist and you're doing a normal amount of tooth whitening, you'll find that it is not a situation that's going to harm your teeth. It's just one like everything else. If you do it too much, certainly I think there could be some problems.
Okay, yeah, and don't fall asleep in them. Take them off before you fall asleep. That's my advice to you. Finally, we're about almost out of time. It's silver fillings.
Well, you know, there's been, for a long time, there's been a big hubbub about silver fillings, and there's a lot of people who, alarmists out there on the internet especially, that will say that the silver fillings have caused lupus and MS and all these kinds of really bad systemic diseases. It's not true. Listen, it would behoove dentists to say yes, and we would make a lot of money by changing everybody's silver fillings, but no, it's not true. Your silver fillings are not harming you. They only need to be taken out when they're getting faulty.
Oh, well, thank you for being honest with us about that, breaking it all down. We appreciate you. Finally, where can they go see you?
You can, our office number is 975-1539. We're on Aldersgate Road.
Okay, go see them, Dunlap Dental.